this is, it is the most prestigious type of filler on the market. It's a company based in France, and they are coming into Canada. We have the privilege at Vic Park to be one of the first centers in Canada to be able to use it. It's been on the market in Paris and Europe for many years now, so it's not like a new filler. This has stood the test of time. Gloria FILLMED team has given me the privilege of my team to use this for a few months now, so I have used it. There's some things I don't like about it. I'm just going to inject it and show you what I don't like on steroids. No, honestly, it really is a very, very nice filler. I mean, generally speaking, all companies have great fillers. Generally, of course. Some companies are better than others. The nice thing about this filler is that you get the benefits of the other big companies without saying the names of the other ones. But there's added benefit, there's multiple added benefits. Number one, we work with a great team like Gloria and the ladies here. They're good support. What I like about it also, the ease of injection. Some products, it's very tough to inject. It's really not fun for the injector. Our thumbs get painful, and this one's so smooth. It's because of the technology of their HA non-cross-linked HA molecules. It's so smooth, it's so easy to inject. You'll see it, it's like so fun to inject, in fact. The added benefit of, I took a contour, but the added benefit of universal, which is the medium range HA size, is that it comes in 1.2 cc's. So for the same price, you're giving 20% extra to your patients. So you do your lip for a cc and you put the laser fold another 0.2 cc. So you're getting more for your buck, and the patients are also love that fact. So we are in Canada now have 3 range products. So there's one more in Europe, but we're getting it soon maybe. So we have the filler fine lines. Now when I do my fine lines, I usually do the cross hatching technique, and you want a filler that doesn't have a Tyndall effect. Tyndall effect, as you all know, is the filler being too superficial, creating a bluish coloration. This one doesn't. But I switched now to this, and it doesn't cause any bluish tint, and I love it. It's really very easy. So I'm going to be using some fine lines for this beautiful lady, a little bit for her tear trough. Okay, so it's a small little tiny molecule, but because she's young, she doesn't have any fine lines yet. ArtFiller Universal is the medium-sized particles I shared with you. This goes anywhere you want. You could contour with it, you could do the lips, laser folds, marionette lines. So we're going to be doing lips for Sarah with the Universal. And we have extra, like I said, 20% in that syringe. And then we have finally the contour, which is the thicker, bigger molecule. I've used many of these. Today I had 3 patients we used contour on. It's for the cheeks, for the jawline, so it's a structure. So I'm going to be using some contour for Sarah, just to contour her jawline. So contour jawline. She has a little bit of a pocket here, not jowling, but more buccal fat, youthful face. That's what we see. So we're just going to fill that up for her too. So you're going to see how I like doing my injections. I hope you learn some of injection techniques, but mostly I want you to kind of ask me questions about the actual filler, see how we use it. So it's always, I always keep the chin down because patients always want to bring it up. If you go like this, you kind of lose the tear trough. You want to kind of exaggerate it, and you tell the patient to look up. This way, the infraorbital fat pad herniates outwards, and you can see the tear trough more, right, Dr. Wong? Mm-hmm. Okay. If I say something wrong, you'll tell me. But you see here, like look up. She's a beautiful woman, young, youthful, doesn't have tear troughs naturally, but because she's doing this, you can see them. Okay, now look straight. So looking straight, they disappear, but there's a tiny bit of a grooving here. So we're just going to inject that. So I'm going to do this. Can everyone see my needle? Okay, look up again. So I'm looking up. There's a vein here, so I always kind of try to stretch the skin to move the veins out of my way. And it's going to go, I'm not going to inject without telling you, okay? There's no surprises, okay? We appreciate you doing this, Sarah. Sorry, there's 1,000 people around you. So I'm going to go deep down into the bone, okay? And usually I go at the medial limbus, so where the color of the eye is. This is usually the deepest area. By putting a tiny bolus here on bone, it could fix the whole teardrop. Okay, so now I'm going to be doing it. When I say 3 on 3, 1, 2, 3, that's when the needle will go in.
Okay.
Okay, so I stabilize my hand with my elbow to my body. My pinky is stabilizing on the patient, so if I move, it won't go anywhere dangerous. I ask the patient to look up, and I look for the place where there's the deepest trough. Can everyone see the needle? Kind of? Okay, you there? So it's going like this. Big breath, 1, 2, 3. So I'm on bone. And here we don't aspirate, I'm just injecting. I'm gonna inject around 0.03. So there is the bolus there. And you already see like a nice improvement. Okay, so look up again. And just go beside it, because you see there's a little bit of a defect there. Again, big breath. You're so good. Okay, so that's basically it. You don't need much for her. Can you hold that with your right hand? Now we're going for the other side. Disinfectant. I'm gonna inject, I'm gonna make a hole where I wanna go in. Big breath. And you see when I pinch it, when I go in, I pinch the skin. Did you feel the needle go in?
No.
Because of that pinch. So this I like doing with two people, like with someone helping me if you can. When I'm alone, then I have a little mayo stand and everything's ready. So yeah. So I'm in skin. You okay? Okay. So the way I go in is I distract her again with a pinch. You know, so as I'm pinching her, I'm going in. Was that okay? Not too painful?
No.
Okay, so my needle's right there, you see it. I want to be injecting here, so I'm just going to orient myself and come back to where I want to be. There. So look how easy this is. This is a contour, it's going in, look how easy it is. It goes in so smoothly. So I could put in a few layers on top of each other, and I already finished with 0.5. 0.5 already done, yeah. So a little bit. Yeah, Irina, I'll take it more. FILLMED has been very generous, so we'll just put a full syringe. Okay.
But I think that's where we're talking about. It goes in very easily, but it doesn't mean the product is very soft.
Okay, sorry. Again, pinch to kind of distract her, and then inject where I want to go. And then one last one, the whole length. What I'm doing now is I'm building a few bridges, different layers. Okay, so it has a snatched jawline.
Sarah, can you sit up a bit? Sit up like yeah.
The Cupid's bow. And I try to kind of do one injection retrograde to create a definition of that upper M. So,
So it didn't snap, essentially.
okay, so now I'm like at where I want to be. You're doing amazing, Sarah. And I'm going to inject retrograde. So I'm just holding it between my fingers to make sure there's no migration. Peak, and now it should be numb because of the xylocaine. So I'm going to go back into the area where it's numb. And continue contouring. The other side should be numb by now, and we're going to contour. It's just such a pleasure to inject it. It's so easy to inject. It goes in so quick. And we've used now 0.2. Beautiful. This is just creating some pillars for hydration, as Gloria said, and some volumization. You don't need much. Yes.
To sneeze.
Yes, play next, please. With this finger, what I'm doing is I'm kind of inverting, yeah, retracting the skin. Okay. Do we have symmetry, or the right upper is still smaller?
So nice.
So I'm just, it's just a bit, I need more volume on the lateral aspects. I'm just seeing it, playing it by ear. It's just now your aesthetics. Okay, so that's it. I think that's a nice lid. She would feel less, and you can see my needle, inject retrograde. Close to the nose is a bit painful. Okay, so yeah, it's already filled it up. So I'm gonna inject over here. And you see how easy it is. It's so, coming out so easy. Right? We'll see in a minute. So put your foot on this light first, and take a look.
Wow, it's so nice. It's beautiful. I love it. I love it.
Yeah.
Yeah.
Yeah. Congratulations. So tear trough, these are the folds, Cupid's bow, a little bit of volume, and the snatch jawline.